Hi, my name is Hiroshi Kawamoto at Kyoto University. I'm going to make a brief introduction of our project using some slides. And so this is a story to produce T cells from iPS cells as off-the-shelf T cells for cell therapy against cancer and viral infection. So this is my own artwork expressing how to produce T cells in our factory. So what are killer T cells? Actually, they kill virus-infected cells or cancer cells. Virus-infected cells present virus-derived antigen, and killer T cells recognize it by using T cell receptor and kill them. So here you can see how killer T cells kill cancer cells. Very strong. And what are iPS cells? Induced pluripotent stem cells. They can generate any types of cells or tissues, originally invented by Nobel Prize winner Shin Yamanaka. And so the upper line shows ongoing T cell therapy, in which T cells are taken out from patient and transduced with exogenous genes and expanded and then given back to the patient. So this strategy is surely very effective against some types of cancer, but still issues are remaining. Time consuming and costly and unstable in quality because they depend on patient-derived T cells. So on the other hand, so in our strategy, we use universal iPS cells as materials, and they are transduced, and then T cells are mass-produced and cryopreserved as frozen stock, which will be used as off-the-shelf T cells. Therefore, it will be universal and rapid. We can achieve low cost because of scale merit, and high quality can be guaranteed. This is actual plan for first clinical application, which we aim to realize in 3 years in Kyoto University Hospital. So acute myeloid leukemia patient will be treated by regenerated T cells when this patient has relapse. So and then next story is to use our cells for COVID-19. So when virus comes, they enter the cells. Then B cells produce antibody that can block these virus, and killer T cells kill infected cells. Both are very important. Then, in addition to antiviral medicine and vaccination, now, so antibody treatment has been developed. But if we can also use killer T cells, so it will provide a new strategy against COVID-19. And at present, to our knowledge, our group is the only one in the world that is going to develop universal off-the-shelf killer T cells for COVID-19. So then the question may arise, why killer T cells have not been used for COVID-19? Actually, antibody from recovered patients can be used to other patients, but killer T cells cannot be used because they will be immediately rejected by patient's immune system. However, if we take this strategy, actually by our strategy, we take out a T cell gene firstly and produce universal T cells that will be given to the patient. And actually, we are developing such strategy in collaboration with Fujita Health University. We have already cloned TCR that can cover 60% of Japanese people, which will be realized in 2024 or so. A good point is that this can be applied to other viral diseases such as SARS, MERS, Ebola, and so on. So I'd like to make a proposal. I think here in the Middle East, MERS should be a threat. Therefore, so we propose to apply our method for MERS. So we can take out TCR gene for MERS from recovered patient, and then degenerated cells can be cryopreserved as a T cell stock, which will be used when next MERS outbreak takes place. And one TCR gene is not good enough, but if you can prepare 5 or 10 TCR genes that can cover most of your population. Finally, this is exhibited object. These are the killer T cells regenerated from iPS cells that are specific for tumor antigen, WT1, the very same cells that we are going to use in the first clinical trial. So thank you very much for paying attention.